this video, we're going to be looking at the link between seborrheic dermatitis and hair loss. I'm going to be talking to you about what seborrheic dermatitis is. We're going to look at the causes, we're going to look at the symptoms, and then at the end of the video, I'm going to show you how you can naturally treat seborrheic dermatitis. Make sure to stay tuned. Hey guys, Leon here, and welcome to the Hair Guard YouTube channel. On this channel, we do tons of science-backed videos all about how you can combat hair loss and regrow healthy hair. Now, if you want updating on all the latest and the greatest hair loss news and discoveries, make sure to hit subscribe and turn the notifications on so you can get notified whenever we make new content. If you're worried about your hair loss, you can click the link in the description to take the Hair Guard hair loss quiz. You'll have to answer a few short questions, then you'll receive free expert advice on how to combat hair loss and regrow healthy hair. It's the very first link in the description, so go and click that now. Now let's get into the video on seborrheic dermatitis. If you suffer from the itching, inflammation and overall irritation associated with seborrheic dermatitis, you're likely desperate to put an end to the condition. This desperation can be compounded in those with alopecia, as some with seborrheic dermatitis can also experience hair loss. So what can you do if you're battling this condition with no effective treatments in sight? Well, in this video, I'll answer this question and more. First, you'll learn what seborrheic dermatitis is, including its causes and most common symptoms. Then you'll learn how dermatologists typically treat the condition and why such treatment methods may not be the best choice. Then finally, I'll show you the natural way to treat seborrheic dermatitis and prevent hair thinning associated with this condition. First things first, guys, what is seborrheic dermatitis? According to the American Academy of Dermatology, or AAD, seborrheic dermatitis is a common skin condition that leads to a scaly, inflamed rash on the affected skin. These rashes may appear reddish in colour and can be found in various places throughout the body. People of all backgrounds and ages can suffer from this skin condition, though there are groups of individuals who are more susceptible. For example, infants 3 months of age and younger, as well as adults between the ages of 30 and 60. Additionally, people with certain health conditions are at an increased risk of getting seborrheic dermatitis, including HIV, psoriasis, Parkinson's, epilepsy, alcoholism, depression, and eating disorders. This condition is not to be confused with dandruff, which is a milder form of seborrheic dermatitis, but that only involves the scalp. So guys, what causes seborrheic dermatitis? While researchers believe that fungal overgrowth is the main cause of seborrheic dermatitis, there are a number of other factors that come into play. These include genetics, stress, exposure to cold and dry climates, and overall health. And while researchers are still trying to better understand the causes and why some individuals are affected while others aren't, they do know that seborrheic dermatitis isn't caused by poor hygiene. While the rash itself can appear greasy, the condition is not linked to poor hygiene. In fact, sometimes the rash can be irritated by overwashing. It's also not an allergic reaction. Redness and inflammation are typically the signs of contact dermatitis, an allergic reaction caused by skin contact with the allergen. Seborrheic dermatitis, however, is not an allergic reaction. So what are some of the symptoms of having seborrheic dermatitis? Well, the 3 most common symptoms associated with this condition are scaly patches on the skin that appear reddish and sometimes greasy or moist, skin flaking resulting in yellowish or white flakes, itchy and burning skin, especially on the scalp, and as with many other skin conditions, symptoms will vary in severity from individual to individual. Now, what conditions are actually similar to seborrheic dermatitis but aren't seborrheic dermatitis? Well, as mentioned, dandruff is a milder form of seborrheic dermatitis but is easily distinguished from it due to location. However, there are 2 conditions which are similar in appearance to seborrheic dermatitis but that have their own causes and require different treatments. The first we're going to look at is scalp psoriasis. Well, the condition most often confused with seborrheic dermatitis, scalp psoriasis is a condition characterized by horny scaling, itching, and general skin irritation. There are 2 major distinctions between these 2 conditions though. First, skin that is affected by scalp psoriasis is typically drier than skin affected by seborrheic dermatitis. Whereas individuals with seborrheic dermatitis may experience greasy and moist skin, those with psoriasis will not. Second, and most important, scalp psoriasis is caused by an entirely different mechanism. Essentially, this condition is an autoimmune in nature and it involves an overgrowth of skin cells, and this leads to the plaque commonly associated with the condition. Also, we've got eczema. Now, yet another skin condition characterized by itchy red patches of skin, eczema is more accurately characterized as a skin reaction. The main difference between eczema and seborrheic dermatitis is the presentation of the rash. Eczema tends to be dry and appears on the limbs and trunk of the body. Seborrheic dermatitis, however, is oily and appears on parts of the body with excess oil production, such as the scalp, face and groin. There are different forms of eczema which can occur, including contact dermatitis and neurodermatitis. Each form has its own cause and therefore own treatments. So what are some of the common seborrheic dermatitis treatment methods? Well, when you visit a dermatologist for diagnosis, it is likely that a number of treatment methods will be presented. For some, the treatments are effective at keeping the conditions at bay. For others, though, the side effects can be many and the results lackluster. Let's take a look. First, let's look at medicated anti-dandruff shampoos. There are a variety of shampoos, both over-the-counter and prescription only, that can combat seborrheic dermatitis. These are the same shampoos used to treat dandruff. The active ingredients will vary and some ingredients may be more effective than others. Some of the more common ones include zinc pyrithione, tar, ketoconazole and selenium sulfide. Before use, however, I recommend that you try an all-natural homemade shampoo. Its use can just be as effective as chemical-laden shampoos and side effects are much less likely. Also, corticosteroid lotions. Now, corticosteroid lotions are synthetic steroid hormones. They're used in the short term to treat inflammation and may prove to be helpful in controlling a particularly painful seborrheic dermatitis flare-up. Of course, such a treatment method doesn't come without its risks. Consistent use can cause thinning of the skin, damage to the hair follicles, stretch marks and an allergic reaction. Also, antifungal creams. Now, as mentioned above, one of the contributing causes of seborrheic dermatitis is an overgrowth of a common skin fungus known as Malassezia. If you're having trouble keeping the fungus at bay, then your dermatologist may suggest an antifungal cream. Some side effects include skin irritation, redness, numbness and tingling, as well as rash. Is seborrheic dermatitis linked to thinning hair? Well, similar to dandruff, seborrheic dermatitis is not a cause of hair shedding. However, the inflammation and irritation associated with the condition can certainly lead to hair thinning and loss. This is mostly due to the excessive itching and scale picking that many sufferers do. Does this mean that all sufferers of seborrheic dermatitis will experience hair problems? Well, absolutely not. But they are at an increased risk of such issues, especially when the condition is left untreated. So how can you actually treat seborrheic dermatitis without using the previous things and doing it naturally? While your dermatologist may recommend a medicated treatment route, there are natural methods to try first. Of course, it's always best to perform such treatments under the direction of a doctor. The first thing you want to do is use oil to soften and remove the flakes. As flaky buildup is the main contributor to itchiness, irritation and hair loss associated with seborrheic dermatitis, the softening and removal of said flakes can help to lessen the condition's effects. All you need is the oil of your choice, and we recommend olive oil for its moisturising and hypoallergenic properties. Apply a palmful of oil to your scalp and massage it in gently for 2 to 3 minutes. Leave on the scalp for at least an hour. Before rinsing, take a fine tooth comb and gently lift the flakes and scales from your scalp. Once all flakes are removed, rinse the oil from your scalp thoroughly and then shampoo as usual. Also, you could use a homemade tea tree oil shampoo to prevent flare-ups. Once the flakes and scales have been removed, it is important that you treat your scalp in order to prevent future flare-ups. This 5-ingredient shampoo can get you started, but feel free to tweak the recipe as you see fit. What you'll need is a cup of apple cider vinegar, a cup of water, a bunch of rosemary, a quarter of a cup of jojoba oil and 10 drops of tea tree oil. What you want to do is boil 1 cup of water, add the rosemary, remove from the heat and allow to steep until cool. Mix the remaining ingredients in the container of your choice. Once the rosemary water has cooled, remove and discard the rosemary and combine the water with the other ingredients. Lather onto wet hair, massaging deeply into your scalp and allow it to sit for 1 to 2 minutes and then rinse thoroughly. Now, the benefits of this is that apple cider vinegar is the cleansing agent in the shampoo. It gently removes the buildup of dead skin and oil, keeping the scalp free of irritating, inflaming scales associated with the condition. Rosemary is anti-inflammatory, treating the effect of the condition in order to prevent further irritation and itching. And last, tea tree oil is antifungal. This helps to control the fungal overgrowth associated with seborrheic dermatitis and can prevent new flare-ups from occurring. And finally, let's look at changing your diet to get rid of all skin problems. Now, given the right building blocks, the body can heal itself. Having seborrheic dermatitis should be a sign that your diet needs improving. And this is our favourite resource for skin problems. Now the first thing is to get rid of all processed foods and replace them with plant-based foods. You may also want to consider getting rid of gluten in your diet. Also remove yeasty products from your diet and including beer and bread. Again, replace these with plant foods. Then consider a detox and vegetable juices. These will help to quickly correlate the pH of your body, allowing it to heal itself more quickly and help to get rid of the fungus naturally. Now, if you suffer from seborrheic dermatitis, you may be concerned that this condition can lead to hair damage and loss. While the condition itself isn't a cause of hair loss, the itching and inflammation associated with it certainly can be. Fortunately, there are treatment methods available for this condition that can target the root cause, fungal overgrowth, and prevent future flare-ups from taking place. Do you have any questions about seborrheic dermatitis or the natural treatments that you can use to treat it? Well, leave it in the comments below. That's what we want to share with you today on seborrheic dermatitis. Don't forget to hit subscribe if you want updating on all the latest hair loss news or treatments that are available. I'll see you in the next video. Thanks a lot.